So my topic today, I'll be discussing from cerebrovascular accident, ischemia. It's not far from what Mercy said. To continue. So first of all, we need to understand the introduction. So a vascular accident, ischemia occurs when the blood supply of the part of the brain is disrupted, causing the brain cells to die. When the blood flows of the brain is impacted, oxygen and glucose cannot be delivered to the brain. Blood flow can be com- compromised by the invariance of the mechanism. The efficiency of the cerebral vascular causes the embraces of beyond 24 hours or it's interrupted by death within 24 hours. Um, Ischemia shock. In ischemia shock, blood supply to the part of the brain is decreased, leading to diffusion and necrosis of the brain tissues in that area. This occurs due to thromboembolic events, which results in the reduction of blood flow, reducing supply of oxygen and hence ATP. Hydrogen is produced by anaerobic metabolism of available glucose. Energy-dependent membrane ions pump fails, leading to cytosis and edema and membrane depolarization, allowing calcium to enter and releasing glucogamate. Calcium enters the cell via glucogamate gets channels and activates destructive intercellular enzymes, destroying the intracellular organs and the cell membrane. With the release of free radicals, free fatty acids release active pro, pro, coagulant pathways that extrapolate local ischemia. Glial cells take up hydrogen that can no longer take up extracellular glycomates and also suffer cells death, leading to the equa- equafatty necrosis of whole arterial resulting to ischemia. We may also note about hemorrhage shock, whereby it is an intracranial hemorrhage in the accumulation of blood, whereas within the scar virtues, a distraction is made between the intraaxial hemorrhage and the extraaxial hemorrhage. An intraaxial hemorrhage is due to the intrapuncture of hemorrhage of intravascular hemorrhage. Continuing, we may also note the systemic hypofusion, whereby it is the hypofusion is the reduction of the blood flow of all the parts of the body. It is mostly common due to cardiac pump failure from the cardio arrest or from the reduction of the cardio output as a result of the microinfarction, pulmonary embolism, and the precardial fusion or bleeding, and also hypoxia that may excuse me, I can't see properly. And that may prepare the um, hypotension because of the reduction of blood flow global, global to all parts of the brain and may be affected. Regions supplied by the major cerebral arteries, for instance, blood flow to these areas do not necessarily stop, but instead it may limb to the point where the brain damage can occur. This phenomena is also referred to as the last meander. Diagnosis of ischemia. The diagnostics, we may look at the lumbar temple, maybe bloody. If the hemorrhage type of the scan shows edema, lesion, structure detail within the higher accuracy in the MRA, which is a strategy of research, details size and location only, and an angiography shows arterial vessels shadow and can identify narrowing, blockage, or rupture in the EEG, which is also a type of research and can access the localization of damage. And treatments, there are two types of treatments that we can look in terms of ischemia, whereby the first one is admission of medication. So these are some of the drugs that you can give to, let's say, a patient: anticoagulation, muscle relaxation. And the second one is surgery, whereby it involves a surgical process in a portion of the cranial is removed to relieve pressure on the brain structure and providing space of the expansion. Thank you.